Once again, welcome to my YouTube channel, A1C, high blood sugar as it relates to diabetes. Today we're going to talk about lymphedemia and diabetes. What is diabetes, and can it make lymphedemia worse? People with diabetes cannot regulate the amount of glucose in their blood properly. After eating a meal, the glucose in the blood increases as the food is digested. In response, the pancreas produces insulin, which helps the cells in the body take glucose in from the blood. People with diabetes are unable to transfer glucose in the blood into the cells, specifically red blood cells. There are different types of diabetes, type 1 and type 2. I'm currently a type 2 diabetic. In either type, the result is increased glucose in the blood. Over time, the increased levels of glucose in the blood can damage blood vessels, connective tissue, nerves, and organs. In the blood vessels, plaque builds up, resulting in blockage of the large arteries, and the small vessels are damaged so that they do not transfer oxygen properly to the tissue. Let me repeat that. In the blood vessels, plaque builds up, resulting in blockage of the large arteries, and the small vessels are damaged so that they do not transfer oxygen properly to the tissues. These blood vessels can become leaky. Poor blood flow can result in damage to the skin and connective tissues, resulting in sores and infections. Excess weight can worsen diabetes. Patients with lymphedemia have leakage of the lymphatic fluid into the tissue, causing swelling and connective tissue damage and increased risk of infection. As this picture illustrates, you can see where the skin is starting to swell. His whole leg is swelling. Obviously, he's overweight. And as you can see, the darkening of the skin is a clear example of the amount of reduced blood flow that both legs are experiencing due to high levels of sugar in this individual's blood. Once again, if you've got too much sugar in your blood basically becomes syrup or similar. The consistency is similar to syrup, maple syrup. And your heart just can't push that thick blood through all the veins and capillaries. So this individual has probably also developed a condition known as neuropathy, where you're losing the feelings, or the nerves in your feet are just disappearing. No blood flow, no feeling, no nerves. So he probably can't feel the bottoms of his feet either, which is a very, very dangerous condition to be in. While diabetes generally causes damage to the arteries and capillaries, lymphedemia is a result of damage to the lymphatic system. Together, these diseases result in damage to both the arteries, or arterial and lymphatic systems, and both lead to damage to the subcutaneous tissues, connective tissues, and skin. Now, once again, I'll repeat that. These diseases result in damage to both the arterial and lymphatic systems, and both lead to damage to the subcutaneous tissue, connective tissue, and skin. That's why you're seeing both those legs, especially the right leg, swelling, and the feet and the ankle area. All that skin is swelling. The result is increased swelling, decreased levels of oxygen in the skin and connective tissue, and susceptibility to infection. You can pretty much figure that both these legs will end up being amputated. Once again, it is important that you get your blood sugar under control. You want to go see a certified diabetes educator. If you have health care, contact your primary care physician and have your primary care physician give you a referral to go see a certified diabetes nutritionist or educator, certified diabetes educator. This is someone who specializes in helping you better understand how to get your blood sugar under control, what to eat, what not to eat, why it's important that you embrace the information that they give you. Because if you refuse to abide by what they're telling you in order to get your blood sugar under control, this is a condition that you could easily end up with. Lipidemia and diabetes is nothing to mess around with. When you're in the grocery store and you see people wearing shorts and sandals, look at their ankles and see if their ankles are starting to darken. See if they're overweight. They probably have undiagnosed high blood sugar and don't even know it. But their ankles are darkening, even swelling. And then there are a lot of people that know they have concerns with regards to high blood sugar, but they just choose to ignore it. Ignoring your high blood sugar, your diabetes, high blood sugar in your blood, excessive sugar in your blood can cause amputation, neuropathy, loss of feeling in the bottom of your feet, and eventually amputation. And not just your feet, but fingers and hands as well. Outer extremities. That's why it's so important to take these situations seriously. We're going to scroll up here, look at another condition. This is another condition. Once again, swelling, dried skin is thickening, seriously losing blood flow in this leg. This is another condition. Dried skin, flaking. This individual is very close to infection. Definitely, the future for this individual is both legs will be amputated below the kneecap. Once again, thickening of the skin, darkening of the skin, blood flow, swelling of the feet, eventually amputation. Please subscribe to my YouTube channel. If you have any questions or concerns, please feel free to reach out to me. Please share my A1C, high blood sugar as it relates to diabetes with anybody that you know who has type 1 or type 2 diabetes, so that they can have this information as well. Thank you so much for reviewing this video.